Okay, guys, Nookie caught Megan's live from this morning where her friend has taken her and her family in and their belongings from the motel. So I guess we don't need money for that anymore, right? Right. I know that everybody likes to discuss teeth. Let's leave this one alone. She has an excuse. Okay? This is what she has. As you know, I work with newly diagnosed rare disease patients. I've had a couple people that had this. There are over 150 different types. Similar to EDS, it has to be classified by phenotype and by symptoms. So if you have this symptom, this one, this one, this one, then you fit in this one. Okay? Does that make sense? Hi, you coming in? You coming in to help? Okay. She shows all the classic signs. They generally, the majority of types of HED live normal life expectancies. Okay. I am interested in one thing she said.
This morning. Yeah, we all are. I can't. Like last night was the best sleep. Last night was the best sleep that me and my family has gotten in a very long time. Like as soon as all three of my boys went to sleep, me and my husband to actually relax. We were actually able to not have to worry about watching our kids run around a house. Good morning, Michael. How are you? We're so used to like going to other people's houses, and instead of just enjoying the company and stuff, we had to constantly watch our kids. Didn't have to do that, and that's something that we're not used to. And for the ones that have been in the line, you've heard my oldest son. He's nonverbal, so when he wants something, he either grunts or he screams to the top of his lungs. And he was just as quiet as he could be.
Okay. The reason I'm interested in the oldest son is she says that he is a level 3 autistic child. I would bet they have not had him tested and that he also has HED, simply because she has 3 children. HED is inherited. It doesn't matter which parent has the mutation. It is a 1 in 2 chance your child will get it. 50%. So if you have 3 children, odds are at least one of them has it. One may have it and one might be a carrier. She shows the classic signs. In some forms, there is severe brain damage. There are varying degrees of brain damage because the corpus callosum is affected in many of them. It is not developed. So I would be interested in knowing if that child had even been tested or if any of her children had been. She should have been genetic tested when she was pregnant. Period. As far as the teeth, lack of enamel, peeling enamel, spaced teeth is one of the symptoms that carries through most of the 150 types. Sparse hair, dry and brittle hair all over the body. And as you can see, she doesn't really have eyebrows. They have fragile skin. They have macrocephaly, where their heads are bigger, their craniums are bigger. They have a distinctive facial type, which she has. She just shows all the symptoms. I mean, she's pretty easy to peg for anyone who knows the disease that she has it. So I've seen some comments about her teeth, and I don't think per se she's the problem in this situation. It seems like the husband is. Now, I had added them to my Tic Tac a long time ago, but I never turned on the notifications, so I would see them sparsely. Whenever I would see him, he was so offensive. He is the antithesis of this woman. He is so offensive that I would just turn it off. It was like, stop yelling at me, dude. Um, I keep hearing him mention that he worked for a hospital, but that he also does IT cybersecurity. I don't even know if any of these things are true. He has all the earmarks of a meth head. He's agitated all the time. His face is drawn and gaunt. He's hyperactive. He's angry for no reason. He has very poor impulse control. I don't know. I haven't watched him enough, but I'm kind of surprised. I heard him say to the sheriff's officer, he was talking to the sheriff's officer, and then he came back and said, yeah, they all know me. They're my friends because when I worked in the hospital, and he described doing jail clearances. Well, either he held a position similar to mine, or he was an RN in the ER and lost his job. Why wouldn't he be working there now? What happened? So if anybody knows the backstory, let me know. I'll keep digging. But yeah, as far as this one goes, she does have the disease. And if they haven't had those children tested and that boy is suffering from it, it can be fatal, especially when there's brain damage. The agenesis of certain brain districts can cause failure as they get older. Their brains don't grow, they don't mature, and it can start off slowly with lack of vocalization and then progress almost like a Tay Sachs in a way. Because as the child grows, the brain isn't maturing. It is not growing as it should normally. Some of them stay as they are, say like at a 4-year-old level, a 2-year-old level, and some pretty much begin to fail. So I would definitely, I hope he's under a doctor's care. I don't know. And like I said, I would hope she would have had genetic testing, that her OB knew she had AGD and was genetic testing her before the children were born. So at least they knew what they were dealing with. I would think she would say it, but then again, there is a lot of backlash from people like me who do not agree with having children if you have an inherited disease. It's not fair to the child. Why would you put them through the pain and the suffering? Especially when there's so many kids out there that need parents, you know? Speaking of rare diseases, unfortunately, my throat has been trying to trigger off, so I am trying not to speak too much. It's probably the ghost of Maddie. Stop it. So I will take a stroll later. And I did my kizzy, and I'm keeping an eye on that. I'm keeping an eye on a couple things, but yeah, I gotta behave. And if I, for some reason, disappear ever, just know, I'm in good hands, and I don't play around with it. And if I go in the hospital, so be it. I'm not filming in the ER. I do not do that. It is stupid. And if you're sick, you should not be whipping out a camera. Okay? Okay. So that's your story on Megan's illness. Oh, and just so you know, her condition, from what it appears, she is going to live a long, happy life. She has to be careful of her skin, be careful of her hair, be careful of those teeth. Oh yeah. You know, there's a famous guy, an actor who has this. I don't know if he's still alive. I always called him Egghead. He always played in horror movies. Hold on, let me find him. This dude. He always played in horror movies. What's his name? Michael Berryman. Yeah. He has it. And that's a pretty classic HED look. No hair, no body hair. They sometimes have the ears, but there's a distinctive facial thing going on, as you can see. Now look at him and look at her. Take her hair off, and yeah, it's very similar. So, I think it's 1 in 10,000 births have it, which is why I'm kind of surprised it's still classified as a rare disease. But it is nonetheless. So there's your lesson on HED and Megan Scott.